Hello, this is Paul Fast, MCC's Global Health Coordinator, and I'm here in the Mubimbi Displaced Peoples Camp in the eastern part of the Democratic Republic of Congo. And while in the United States and Canada, we're almost seeing the end of the worst of the pandemic, places like Mubimbi are just starting their journey. There are no vaccines here yet in this part of Congo, and these are communities that already have so many issues they're dealing with. Cases of diarrhea, of malaria, of cholera. And just recently, a few days ago in Goma, which is just north of here, the volcano exploded. You may have seen that on the news, and thousands of people, including the MCC staff, and I was with them, had to flee for safety. And so these are communities that are dealing with so many issues, and they don't have the capacity to deal with coronavirus. This is the clinic that MCC supports, and they can take care of primary care needs, some emergency care, things like broken bones, diarrhea, infections. But they don't have the capacity to treat someone with acute coronavirus. They don't have oxygen, they don't have inpatient beds. The nearest hospital is quite a ways away. So as the nurse here, Furaha, was just telling me, prevention is much better than treatment in these cases. And that's how they that's how they deal with all of the diseases they face. But it's even more true of coronavirus. So communities like this are going to be waiting years before they're able to get the vaccine. In the meantime, we make sure they have the preventive equipment they need. They have masks, they can wash their hands, they can educate the people on how to stay safe. But it's very hard to take precautions in houses like this that are very crowded, a lot of people, average of 7 people living in each of these. And so even basic precautions are very difficult. So thank you for your support of places like Mubimbi, the Displaced Peoples Camp here in Congo, for the clinic here, for the nurses like Furaha, who are taking care of patients every day, who do this work because they know it matters in their community. And our role as MCC is to be here walking alongside them, making sure they have what they need to stay safe and be able to keep treating people up until when they can get vaccines, and they can make sure that they can weather this storm just like they've weathered so many before. Thank you for your support.